Sounding hoarse for a day or two after shouting at a concert or a football game is not a cause for great concern. However, if you or your child has been experiencing hoarseness for longer than 2 weeks, you will want to be examined by a doctor. Your doctor may recommend voice therapy to help you regain your voice. Voice therapy for hoarseness. Learn how to fix a hoarse voice. What are the causes of hoarseness? A hoarse voice is a change in the quality of your voice. Hoarseness may be characterized by a breathy, raspy, or strained sound. The changes can range from mild to severe, affecting your ability to be understood. An injury or irritation is typically the cause of hoarseness. Voice disorders can affect adults, teens, and children. There are several possible causes of hoarseness and other voice disorders. Some common causes include smoking. Smoking and exposure to secondhand smoke can be a significant contributor to hoarseness or other voice disorders. The chemicals in cigarettes and other tobacco products can irritate and damage the vocal cords. Allergies. Allergies and postnasal drip can cause inflammation of the vocal cords, which can lead to hoarseness. Acid reflux. Acid reflux occurs when acid in the stomach rises into the esophagus, causing irritation and swelling of the vocal cords. Excessive voice use. Speaking or singing for long periods can strain the vocal cords and lead to hoarseness. Infections. Viral infections, such as a common cold, can be a cause of hoarseness. Bacterial infections, such as laryngitis, can also cause the vocal cords to become inflamed and lead to hoarseness. How is hoarseness diagnosed? Hoarseness is typically diagnosed during an evaluation by an otolaryngologist, also known as an ENT doctor. Your ENT will listen for a hoarse, breathy, or raspy voice during the evaluation. The doctor will ask you questions about your medical history and symptoms and perform a physical examination of your voice box. Your doctor may recommend voice therapy as the first line of treatment for a voice disorder. A speech-language pathologist specializing in voice disorders, also known as a voice therapist, is the best person to evaluate your voice. What should you expect from a voice therapy evaluation? A voice therapist will evaluate your voice to determine the cause of your hoarseness. The therapist will assess your vocal range, pitch, loudness, and quality. They'll also ask about your medical history and symptoms. Your voice therapist will create a personalized therapy plan based on the information gathered during the evaluation. What are the goals of voice therapy? If you have a child who is going through voice therapy, you can expect them to learn how to use their voices safely and correctly. They'll also develop proper vocal hygiene habits. As an adult, you may learn how to use your voice in a more effective way. This can help if you use your voice often at work, such as if you're a teacher, salesperson, or lawyer. You can also expect to learn how to project your voice and how to use proper breathing techniques. This can help you speak more loudly and for longer periods of time without tiring out your voice. Some typical goals of voice therapy include reduce swelling and inflammation of the vocal cords, improve the function of the vocal cords, reduce muscle tension, increase stamina and endurance, enhance breath support, improve pitch and volume control. At Connected Speech Pathology, our team of licensed speech-language pathologists has the experience needed to provide you with effective voice therapy. All of our voice therapists are highly knowledgeable in the research and techniques specifically designed to treat voice disorders, including hoarseness.